Fracture treatment does not end with surgery or reduction, the subsequent rehabilitation training is equally critical. Quality rehab not only accelerates healing but also helps patients rebuild muscle strength, restore joint flexibility, and improve neuromuscular coordination, ultimately enhancing the quality of daily life. Whether during hospitalization or while recuperating at home, a scientific and well-planned rehabilitation program must be emphasized and followed. Below, we detail the importance of rehabilitation training, its many benefits, and the stage-by-stage training methods along with key precautions to guide you through the entire recovery process. 1. The necessity and overall significance of rehabilitation training. Rehabilitation determines ultimate recovery outcome. Many patients mistakenly believe that treatment is complete once surgery is over or once they are discharged. In reality, rehabilitation training is the key to fully restoring function. Clinical data show that if systematic rehab is not initiated promptly after surgery, or if the optimal window is missed, the patient may suffer from local weakness, and muscles and joints can atrophy or become stiff. Rehabilitation helps prevent such secondary injuries while promoting callus formation at the fracture site, ensuring better healing. For example, Mr. David Johnson once experienced significant functional limitations because he neglected his rehab exercises. However, after persistently following a customized training plan, he eventually regained the independence needed for daily activities. Preventing complications. Fractures are often accompanied by soft tissue injuries and impaired blood circulation, conditions that can lead to swelling, blood clots, pressure sores, and other complications. Adequate rehabilitation can promote blood and lymph flow in the affected limb, reducing swelling and bleeding while lowering the risk of deep vein thrombosis, urinary tract infections, and similar issues. Patients confined to bed for long periods are especially prone to pressure ulcers. Gentle bedside exercises can help boost overall circulation, effectively preventing these complications. Restoring muscle, joint, and nerve function. Fractures damage not only the bone but also the surrounding muscles, ligaments, and nerves. Without targeted functional recovery exercises, these tissues may become adherent, lose elasticity, or gradually atrophy, thereby impairing overall mobility. Early initiation of both passive and active rehabilitation improves local blood supply and activates nerve reflexes, promoting coordination and balance. With gradual exercise progression, many patients move from relying on assistance to independent activity. 2. The multiple benefits of rehabilitation. Promoting fracture healing. Proper rehabilitation improves blood circulation around the fracture site. As muscles contract repeatedly, slight micro-movements occur between fracture segments that facilitate callus formation, thereby accelerating bone healing. For instance, Ms. Emily Roberts, after her surgery, followed a daily routine of gentle manual traction and joint exercises, thereby shortening her recovery period and enabling her to resume regular activities sooner. Rapid reduction of soft tissue swelling. Immediately following a fracture, soft tissue trauma typically causes localized swelling and minor bleeding. Prolonged inactivity can lead to fluid and blood stagnation, further delaying recovery. Moderate rehabilitation allows muscles to actively squeeze, enhancing venous and lymphatic drainage. For example, Mr. Michael Adams, with help from his family, did simple limb exercises daily and noticed his swelling diminished much faster than expected. Alleviating joint stiffness and reducing muscle adhesions after a fracture. If the affected area remains immobile for too long, soft tissues are likely to stick together, resulting in persistent joint stiffness that hampers movement. A structured early rehabilitation regimen helps prevent abnormal adhesions between muscles, joints, and ligaments, preserving their natural elasticity and contractile function. For instance, Mrs. Sarah Thompson began gentle passive range of motion exercises early on and later achieved a significantly better range of joint movement than typical cases. Preventing muscle atrophy and maintaining strength. Prolonged immobilization leads to muscle atrophy and loss of strength, not only affecting the injured area but also causing long-term mobility challenges. Early and progressive rehabilitation stimulates muscle regeneration and recovery, helping to maintain or even increase muscle mass so that normal strength is swiftly restored. Numerous cases show that patients who adhere to their rehab regimen gain much more strength compared to those who neglect their exercises. Enhancing neuromuscular reflexes and coordination. Whether the fracture is in the upper or lower limb, recovering nerve function is among the most essential aspects of rehabilitation. Specific exercises help rebuild neuromuscular feedback, improve balance, coordination, and reaction speed, thereby reducing the risk of falls and re-injury. For example, after knee or hip replacement surgery, targeted balance and coordination training enabled Mr. Robert Wilson to regain a stable and agile gait, reducing the risk of bed-related complications. Patients who remain bedridden for extended periods are at risk for a host of complications such as pressure sores, lung infections, and urinary issues. Initiating rehabilitation as soon as possible not only boosts circulation but also facilitates a gradual return to independent mobility, significantly reducing the incidence of complications associated with long-term bed rest. 3. Implementation strategies and family guidance for rehabilitation training. Successful rehabilitation hinges on the coordinated efforts of both the patient and their family. Relying solely on rehabilitation therapists and physicians is not enough. Daily support at home is crucial. Below are various stage-specific exercise strategies designed for fractures affecting different body parts. 1. Upper limb fracture rehabilitation techniques. Early stage, during immobilization. Passive movements, with gentle assistance from a family member. Perform passive exercises such as light fist clenching and gentle shoulder pressure. Avoid any forceful movements that might aggravate the injury. Assisted massage. Light massage can promote local blood flow and reduce swelling, but it is essential to control the pressure so the patient experiences only minimal discomfort. Middle stage, after wound healing. Active exercises. The patient should begin attempting active movements, such as clenching and relaxing the fist and simple arm stretches like shoulder abduction and adduction. Start with a few repetitions and gradually increase the number and range of motion. Assisted range enhancement. Family members can help extend the range of motion while monitoring for pain and adjusting the intensity appropriately. Later stage, functional recovery. Symmetrical training. Once the patient meets clinical recovery standards, focus on training the unaffected limb symmetrically with the injured one to promote overall coordination and help the affected side regain normal function. 2. Lower limb fracture rehabilitation techniques. Early stage, 1 to 2 weeks post-injury. Localized muscle contraction. With family assistance, initiate gentle compression exercises on the thigh muscles, combined with ankle dorsiflexion and plantar flexion exercises. Perform 8 to 10 repetitions per set, holding each movement for a few seconds, to stimulate blood flow. Activation of the healthy limb. Engage the uninjured leg in simple activities such as supported transfers to prevent overall muscle weakening. Middle stage, 2 to 4 weeks post-injury. Joint movement exercises. Under professional guidance, begin gentle movements of the injured joint, such as slowly bending and straightening the knee and ankle. Introduce partial weight-bearing exercises using a cane or walker. Gradual progression. Increase exercise duration and repetition based on patient tolerance, ensuring steady improvement in joint range of motion. Later stage, 5 to 7 weeks or longer, weight-bearing training. As the fracture site stabilizes, gradually incorporate stair climbing, short-distance walking, and light resistance exercises. Dynamic balance drills. With family help, perform gait training and balance exercises to restore independent mobility and smooth walking. 3. Rehabilitation for long-term bed-bound patients. For patients who continue to be confined to bed after surgery, early rehabilitation is crucial to prevent severe complications. Shoulder rehabilitation. Passive shoulder exercises. With the patient lying supine, have a family member gently hold the affected arm at the wrist and slowly guide it through shoulder abduction, internal rotation, and upward arm raise. Each movement should be held for 3 to 5 seconds, repeated 10 to 15 times, then slowly return to the starting position to prevent stiffness and adhesion. Elbow flexion and extension. Assisted elbow movements. The caregiver should support the patient's forearm and guide slow, controlled elbow flexion and extension exercises to prevent spasm and maintain range of motion. Aim for 10 to 15 repetitions per session, with each movement held for 3 to 5 seconds. Comprehensive bedside routine. Regular position changes and light massage. To avoid pressure sores and enhance circulation, caregivers should assist the patient in changing positions regularly and perform gentle massages along the bed-bound areas to stimulate blood flow and minimize complications. 4. The role of family and social support in rehabilitation. Long-term rehabilitation requires active participation and mutual support among the patient, family members, and the rehabilitation team. Family involvement is critical not only in mastering the exercise techniques but also in ensuring consistent practice. Recommended strategies include learning standardized exercises, watch instructional videos or attend rehabilitation workshops to accurately learn proper techniques. Creating a daily training schedule, use a calendar or mobile app to track exercise routines and progress, enabling timely adjustments and motivation. Fostering a positive environment, engage in regular communication and provide emotional support to create an optimistic atmosphere that encourages the patient. Regular follow-up, maintain periodic consultations with rehabilitation professionals to ensure that the training program remains aligned with the patient's health status and progress, and adjust exercises as necessary. 5. Comprehensive effects and ultimate goals of rehabilitation training. A systematic and continuous rehabilitation program can lead to significant improvements, including restoration of muscle strength and joint flexibility, helping patients rebuild localized muscle power and prevent long-term functional loss. Enhanced blood circulation and reduced swelling, accelerating the absorption of edema and preventing re-injury through improved vascular function. Reconstruction of neuromuscular coordination, reinforcing the neuromuscular response to improve balance, reaction time, and overall mobility. Minimization of bed-related complications, reducing risks such as pressure sores and infections via regular activity and movement. Regaining independence. The ultimate goal is to enable patients to transition from relying on assistance to achieving complete self-care, thereby reclaiming their independence and dignity. Moreover, rehabilitation is not just a physical process, it also helps boost the patient's confidence and reduces uncertainty about the future. Successful rehab transforms not only physical functions but also contributes to substantial mental and emotional recovery. Bone fracture rehabilitation is not merely an extension of medical treatment, it is a crucial segment of the overall recovery process. Only through consistent, scientific rehabilitation training can patients ensure complete healing of the fractured area and restore full function. Whether it involves upper limb, lower limb, or bed-bound patients, early and appropriate rehab exercises markedly improve recovery quality and prevent multiple complications. Every patient and their family should regard rehabilitation training as an essential component of treatment. Starting today, commit to daily rehab exercises using scientifically proven methods and steadfast determination, and together pave the way toward complete recovery and renewed independence. May every patient, supported by family and guided by professionals, embrace rehabilitation with both determination and care. By turning every exercise into a step towards regaining mobility, you can transform your journey from injury to a vibrant, self-reliant life.